Welcome to Monday's edition of COVID-19. I'm Min San-hee. Ongoing social restrictions and public inoculations have yet to tame Korea's fourth wave, and we explore the challenges faced here and elsewhere later on in the program. We start now with the broader pandemic coverage with our Kwon So-ah. So, welcome.
Hi, Sunny.
Right, so I hear we're starting the work week with the daily tally below 1,500.
Right, Sunny. Following the weekend, we are seeing a decline in infections. 1,487 is the caseload we are seeing as of 12 a.m. this Monday, and that includes 1,426 domestic and 61 imported cases. And with that, Korea has surpassed 250,000 infections in total, and the death toll currently stands at 2,284. We are seeing the same pattern that we've been observing throughout the past weeks, a decline after the latter half of the work week. But if we compare this Monday's figure to last Monday, there has been an uptick in cases by 70 infections. If we go over to our next graph, that is here, we are seeing that slight increase compared to last Monday. Now, a special concern this Monday is that in the capital Seoul, we're seeing 444 infections, and that is the highest caseload we are observing for a Monday figure. Now, the government noted a slight decline in infections in the past 2 weeks after movement across the nation has declined past National Liberation Day. And the government is reviewing special antivirus measures for another longer holiday period next month, along with social distancing levels that will have to take effect beginning next Monday. Here's more from Prime Minister Kim Boo-kyum.
We're working with a sense of urgency to turn the tide of the fourth wave before the Chuseok holidays, as we could face another crisis in our containment efforts due to increased movement around the holiday period. Experts have warned that the number of patients could rebound to above 2,000 at any time.
Meanwhile, officials on Sunday called on extra vigilance regarding the rising number of infections among students in recent weeks. A week after many elementary, middle, and high school students returned to school for their second semester, students account for an average of 160 cases a day. There are in particular concerns over transmission within households, cram schools, gyms, and PC rooms that could lead to secondary transmissions at schools. Now, a quick update on the vaccination front. Korea now has 28.6 million people vaccinated with at least one dose, and 14.6 million are fully vaccinated.
Right, so I'm moving on to inoculation updates abroad. I understand Singapore is now the most vaccinated country in the world.
Yes, Sunny. Singapore has hit a milestone on Sunday local time, having fully vaccinated 80% of its roughly 5.7 million population, making the country with the world's highest vaccine rate of complete vaccinations. In Israel, booster shots are now available for almost everyone, as the country has expanded to its booster shots for people aged 12 and above 5 months after the second shot. And following recommendations, that is, by Israel, there have been hints from U.S. President Joe Biden of booster shots being administered 5 months after the second shot. But for now, according to infectious disease expert Anthony Fauci, that timeline will remain at 8 months after the second shot. Let's also get a quick look at some of the numbers abroad. We are seeing Iran here inching closer to 5 million cases, having surpassed Colombia in its total caseload in the past day. And another Southeast Asian country here, the Philippines, has been added to the list here with 1.9 million cases, now the country with the 20th highest caseload around the world. And the total number of infections stands at 217.2 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, amid hopes to fully inoculate 70% of the population by this October, we now take a look at the system in place to verify COVID-19 vaccination, including the application process and tangible packs.
Im Sira is a nurse who works at a general hospital in Seoul, and she recently got an AstraZeneca shot to complete her full 2-dose vaccination.
2차까지 맞는 과정이 좀 숙제 같고 걱정이 많이 됐었는데 지금 2차까지 끝나니까 너무 홀가분하고 좋습니다. 제가 직업 특성상 어르신들을 뵙는 일이 많은데 혹시라도 저 때문에 어르신들에게 피해가 될까 봐 아니면은 제가 위험에 노출될까 봐 걱정되기도 했었는데 이제 좀 안심할 수 있을 것 같아요.
Ms. Lim is at this community service center today to receive her proof of vaccination.
안녕하세요. 백신 접종 증명서 받으러 왔습니다. 네.
저희가 발급해드리고 있는 예방접종 증명서에는 인적사항, 백신 종류, 접종 일자, 접종 차수, 그리고 접종 기관이 기재가 되어서 A4 용지로 출력이 되게 됩니다. 65세 이상 어르신들께 접종 완료 카드를 발급해드리고 있습니다. 이 카드 같은 경우에는 명함 크기이기 때문에 평상시에도 편리하게 소지를 하실 수 있는 카드인데요. 강동구 내에 있는 공공시설을 이용하실 때에 접종 확인용으로 또 활용을 하실 수 있다는 장점이 있습니다.
Korean government-issued vaccine certificates are currently available in 3 different forms: a digital QR code certificate, a hard paper copy, and a vaccination sticker.
저희가 예방접종 증명서와 함께 스티커도 같이 발급을 해드리고 있는데 증명서는 이제 휴대가 어려운 반면에 접종 스티커 같은 경우에는 신분증에 부착을 하기 때문에 간편하고 편리하게 접종 증명을 받으실 수 있다는 장점이 있습니다.
You can download a digital copy of your vaccine certificate on your smartphone through the use of a mobile app. It is believed that vaccine certificates, along with a set of incentives that come with them, can encourage more vaccine uptake among those who've yet to be inoculated. So what actual benefits can residents enjoy by presenting these vaccine certificates? Although the incentives on offer differ by each jurisdiction, some of the benefits include exclusive access to designated public venues, and even discounts and gift vouchers, among others. Here, in the city of Seongnam, diners can also receive special discounts on their meals by showing their proof of vaccination.
여기 백신 인센티브 식당 맞나요?
예, 맞습니다. 맞으신 거 한번 보여주시겠어요?
네, 여기 있습니다.
아, 예, 맞습니다. 앉아서 식사하시면 1,000원 빼드려요.
This is one example of a private vaccine incentive that has been rolled out by small businesses in the community.
저희들한테 지금 뭐 바로 혜택은 없겠지만 코로나가 좀 잠잠해지기를 바라는 마음에 백신을 모든 분들이 빨리 맞아야 저희도 조금 영업 제한 시간도 풀릴 거고 이럴 거라는 생각에서 그렇게 한 거죠.
Around 40 restaurants in the region so far have joined the special discount program for vaccinated diners.
코로나19 방역의 최우선 과제가 예방접종이라 생각합니다. 백신 예방접종 참여 분위기 조성을 위해 일반 시민들이 매일 이용하는 외식업소에 자율적인 참여를 협조토록 하였고 참여하는 외식업소들도 어려운 여건 속이지만 적극 공감하여 참여하고 있습니다.
But what are the remaining tasks at hand to roll out incentives that are not only appealing to the public, but also in line with our efforts at prevention?
One thing that was stuck in my mind in regards to medical certification, in regards to the vaccine, was that how we should go about making this a global connection. I think it'll be a great incentive to the people who are, just like myself, hoping and planning to go abroad once the pandemic becomes much easier. Then we'll be able to just grab onto our phone, show to these people overseas that we're safely immune and we're free to go wherever we want to.
The next step of our challenge will be to work with the global community to create a standardized vaccine passport to facilitate cross-border travel and other incentives that can be enjoyed beyond our own soil.
Up next, we bring you the regular afternoon briefing on the pandemic situation here on the local front for this Monday. And while we wait for that to start, here are a few reminders. First up, with regard to inoculations for those aged between 18 and 49, online reservations remain open until the 18th of September. So do seek to make a booking for your vaccine if you've yet to do so. Also, special prevention measures for the Chuseok holiday are still being discussed, with officials currently saying the guidelines may be disclosed within this week. For now, social distancing guidelines under level 3 and 4 are in place nationwide, but with a few modifications. The most tangible of these changes are those that affect drinking and dining establishments, including such services provided at some convenience stores. Under Level 4, these venues can accommodate patrons until 9 p.m., while under Level 3, the in-house catering ends at 10 p.m. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Commissioner Chung Eun-kyung with the explanation on the briefing. I am Commissioner Chung Eun-kyung of the KDCA, and let us now begin our regular briefing for August 30th. First of all, on the COVID-19 vaccination update, here are some details. As of today at midnight, we have a total of 28.64 million people receiving their first dose of the COVID-19 vaccine, which is about 55.8% of the country's population. And we have about 14.61 million people being fully vaccinated, which is 28.5% of the total population. And by age group, as for the first dose, those in the age of 60s, we have the highest rate of 92.7%. And also, this is followed by those in the 70s and 50s, who stand at about 91, and about 82% in those in the people of the age group of 80s. And over the age of 80, we have seen also some 79% of the people have been fully vaccinated. And as for the general adults aged between 18 and 49, we have also more people who have already received their COVID-19 vaccine through surplus vaccines and other forms, and we believe that about 87% of them will get the vaccination. And right now, as for this age bracket, we are receiving the COVID-19 vaccination reservation, and this is open until the 18th of September. So if you have not yet done so, we ask for your continued participation going forward. And next, as for those aged between 12 and 17, and also for pregnant women, and also additional doses, we have some updates as well. And the COVID-19 vaccination task force have been meeting with the committee members, with experts, and they have discussed measures for the vaccination for pregnant women and also teenagers, as well as the booster shots. And up until now, they have also mentioned that up until now, we have also not included those who are pregnant and also teenagers to not be subject to the COVID-19 vaccines. However, they have now recommended the vaccine to the pregnant women as well as teenagers. And currently, the pregnant women are being set and categorized as high-risk group of COVID-19. And here in South Korea, we are going to include these people within the category of those who are eligible for the COVID-19 vaccine. And as for teenagers, we are going to vaccinate those over the age of 12. And after we have the confirmation by the Korea FDA, and we also will be including these teenagers within our eligible recipients as well. And we believe that as for teenagers, within a certain period of time, we believe that these people will also have, as for the additional doses, that is for the booster shots, we are going to recommend the booster shots, additional shots after 6 months of being fully vaccinated. And reflecting on such recommendations, we will be including these details, and we will be announcing such guidelines for these group of people in the month of September. And going forward, we will be finishing up with our vaccination for those between the ages of 18 and 49 by end of September. And in Q4, we will be also considering to inoculate our pregnant women as well as teenagers. And going forward, we will be disclosing the guidelines as soon as we have the details. And as for the booster shots, we will be also aiming to roll out the vaccines starting from for Q4, and we also will be having those people who have seen the passing of at least 6 months after their full inoculation to be subject to such booster shots. And as we have more data accumulated as for the COVID-19 vaccines, we believe that we are also having no intervals for the other vaccines for other kinds of diseases, and going forward forward, we are going to expand the scope of our eligible recipients, and going forward, we believe that there would be no interference of the COVID-19 vaccine as to other vaccines that are currently carried out here in South Korea. And as for the vaccine arrival and supply date, as for the 31st of August, we also have about 1.1 million doses of the AstraZeneca vaccine to be shipped from Andong plant. And here in South Korea, we have about 20 million COVID-19 vaccines for the AstraZeneca that have been signed here in the country. And we will be finishing up the supply with this last batch to be shipped from the Andong plant. And as for the COVID-19 vaccination post-inoculation adverse responses, we have had about 0.41% of the report ratings. And as for common symptoms and general symptoms like headache and fever, we have about 95.6% of the total cases accounting for these general symptoms. And also as for AstraZeneca vaccines, we have about 0.5%, and Pfizer vaccine 0.31%, and also Janssen vaccine 0.65%, and Moderna 0.52% when it comes to the report rate of such inoculation adverse responses. And in order to secure a safe inoculation environment, we ask you to take particular precautions. All of the recipients need to also stay at the vaccinated places for the next 15 to 30 minutes to monitor if you have any symptoms of anaphylaxis, as well as other critical ill symptoms. And also as for the mRNA vaccines, including Pfizer and Moderna, you could be exposed to rare cases of myocarditis and also heart inflammation. So if you have any chest pains or also difficulties in breathing, we ask you to also take particular precautions and visit a doctor as soon as possible. And as for AstraZeneca and Janssen vaccines, you could also be exposed to rare cases of the blood clots. So if you have a severe headache or also stomachache and also difficulties in breathing, we ask you to visit a doctor as soon as possible. And we are going to share with you some of the updates on our weekly assessment of the COVID-19 outbreak. During the past week, we have seen average daily domestic infection standing at 1,702, which is about 2.7% decrease from the previous week. And in the metropolitan area, we have seen a 1.1% on-week incline, while non-metropolitan area have seen a 9.2% on-week decline. And the reproductive index of the virus now stands at about 0.99, which is slightly declining from last week's figure. And as for imported cases, we have also 43 average daily infections. This is a drop from the previous week as well. And by age group, we still have many people accounting for from the people who are aged 20 and between the ages of 20 and 30. And we also saw a slight decline in the number of patients in their 50s. And as for the major sources of infection, we see most of the cases still account for as for the contact with previous infected people, accounting for about 49.3% of the total cases. And as for new cluster infections, most of them were workplaces, and there were also many other multi-use facilities and education facilities and religious facilities, as well as hospitals and other healthcare centers. And as for critically ill symptom patients, we have had about 417 standing at the average, which is continuously increasing. And 7-day fatalities now stand at about 74, which is a slight increase as well. And we also have about 220 people who are in their 40s and 50s when it comes to critically ill patients. And also we have about 100 people who are over the age of 60. And also we have 52 people who are in their 60s as for the fatalities, which account for 70% of the total fatalities reported here in South Korea. And lately we are seeing some risk factors of the COVID-19, and here are some analyses. After the month of July, we have seen a major cluster infections breaking out at general hospitals and nursing and other big hospitals. And aside from nursing hospitals and long-term care centers, we are seeing a new emergence of the cluster infections. And as cluster infections break out at such healthcare places, we believe that this could also have severe challenges on our medical response capacity. And as for the hospitals and other clinics, we ask for you to encourage people to get their vaccination to prevent the virus spread. And even after being fully inoculated, we ask you to refrain from going to any hospitals if you have any symptoms of COVID-19, and also get tested as soon as possible upon showing symptoms. And all of the medical professionals and also caregivers, you are also advised to wear face masks at all times. And after September, we also have more schools opening their doors, and we are also seeing a higher risk of COVID-19 infection at school campuses and also educational facilities. So we ask for you to also take particular precautions at school campuses, including wearing a face mask and also ventilation. And as for dormitories and also cram schools, we ask you to get the regular PCR testings as well. And lately at the indoor sports facilities, which also have the facilities like the public bath facilities, we are also seeing new cluster infections breaking out at such facilities. And we believe that these facilities are prone to virus infection as they have poor ventilation, and also they have high risk of respiratory droplets travel. So we ask you to wear your face mask at all times when you are using such public venues. And we are also seeing an increase in the number of foreign confirmed cases, and we have also seen about 13.8% of our total cases being attributed to the foreigners here in South Korea. And most of these people are requiring some tailored COVID-19 restrictions. To this end, the government is looking at tailored guidelines centering around the regions, the foreigners communities here in South Korea, as well as the workplaces that hire many migrant workers. And we will be cooperating with other ministries to also advise these people to get their vaccines. And as for the Delta variant, this is currently fueling the COVID-19 fourth wave here in South Korea. And we are also acknowledging the fact that you have been also participating in our social distancing guidelines. And we are also exerting our full efforts to trace down our patients. And thanks for such efforts, we are also able to scale down the total infections. However, we have still many people not inoculated right now here in South Korea, which is also spreading the virus on a continuous manner. And also up until this week, we also have the second dose inoculation for those aged between the 60s and 74, that is. And it is very important that you get your second shot in order to prevent the infection amid the Delta strain spread. And luckily, AstraZeneca vaccines, we are seeing a low rate of adverse responses in the second dose rollout. However, it is very important that you need to monitor your health conditions even after being inoculated with the second dose. And as for the children of such senior citizens, we ask you to also take particular precautions when your parents are getting the inoculation. And thanks for your increased public awareness, we are also seeing many people taking in the inoculation rollout, and we expect over 80% of the general public aged between 18 and 49 will get their COVID-19 vaccine. And we also thank the medical professionals as well as the public servants on local governments who are exerting their full efforts to also meet our target of the COVID-19 vaccination. And we are also, as mentioned earlier, we are going to expand the scope of our eligible recipients to include teenagers and pregnant women when it comes to the COVID-19 vaccine rollout. We will also exert our full efforts to this end, and we continue to ask your precautions and also participation in the face mask wearing mandate, and also getting tested if you have any symptoms, and also practice of social distancing, and as well as participation in the vaccine rollout.
Right, that was Cheong Young with Monday's afternoon briefing, and Soa joins me back at the desk with a summary of her address. Soa, welcome.
Yes, Sunny, hi again. Well, there's been some very important announcements made by the KDCA chief Chung Eun-kyung. First off, the government is recommending a vaccination for teenagers aged 12 to 17, as well as for pregnant women. And that following a meeting of experts last week that was based on cases abroad where there seemed to be no safety issues regarding vaccination for these specific groups of people. And the other major announcement was on booster shots. The government is recommending administering booster shots 6 months after full vaccination. So these booster shots are expected to be starting to be administered in the fourth quarter of the year. Now, regarding booster shots for the pregnant women and those aged 12 to 17, the government is expected to make a further announcement in September. Meanwhile, the number of infections in the past week, the number of domestic transmissions, the average stands at around 1,700. That is a decline by 2.7%, a slight increase in the capital region, but a 9.2% decline in the non-capital regions.
I see. All right, so thank you very much for that.
My pleasure.
외국인 등록번호가 없는 외국인이라 하더라도 보건소에 방문하여 여권으로 임시관리번호를 발급받아 백신 접종을 신청할 수 있습니다.
In our studio session on this Monday, we reassess containment efforts here and elsewhere as countries in the Northern Hemisphere look to usher in their second autumn amid the pandemic. Here in the studio, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Great to be here again.
And joining the session virtually is Hiroaki Wada over in Japan. Good to see you again, Hiroaki.
Thanks for having me again.
I also have Jan Hobel over in Germany live on the line. It's been a while, Jan.
Yes, nice to meet you again.
Right, we'll start here in the studio then. Professor Chung, one worrying reality about the fourth wave here in the country is the surge in the number of critically ill patients who now stand at 417 according to Chung during this afternoon's briefing. How do you explain this rise in this figure?
Well, it's a matter of fact because we are seeing a tripled number of cases compared to before our fourth wave. So before the fourth wave, we could see a 4% of transition to critically ill patients. But that at that time, we had only 500 around. So that was summed up about 20 patients per day was transferred to ICU. But these days, we are seeing 1,700 daily cases. So these days, we are seeing only 2 or 3% of our cases are being transferred to a critical care unit. But since the total number is high, we are seeing many patients these days. And luckily, but I can say that we are almost at the peak of fourth wave. And we'll be facing a downward slope sooner or later. That's not because of a social distancing, because the social distance has been done for more than a month here in capital area or also in non-capital area. So it's not working now. But the vaccination rate is very high, even 1% increase by day by day. So that, I think that is preventing the rapid spreading of infection these days. So maybe in end of October, we'll be completing fully vaccinated people in 70% of our population. Then we'll see a very low critically ill patients and very low case fatality rate.
Right, well, that would be quite comforting. Meanwhile, in neighboring Japan, Hiroaki, the daily tally has been hovering above 20,000 in recent days, while the death toll recording double digits. Do tell us a bit about the COVID-19 situation in Japan, Hiroaki.
Yeah, thanks. As you said, the number of new cases is still very high, even though we might be experiencing a peak up because the numbers are decreasing in the past couple of days. But at the same time, the overall number of serious cases remain high, with more than 2,000, right? And more problem than that probably is the fact that so many people cannot even reach the hospital. The number of people who are forced to stay home is more than 110, even more than 120 late last week. And these people are really concerned that their conditions may change really rapidly for the worse. The government is trying to increase awareness of those people and trying to establish a system so that those people who are staying at home can reach medical care as soon as possible. But we already see a number of people who are dying at their home with their conditions worsening really quickly. And frontline doctors, nurses, and caregivers, they are doing their best with the resources they have. But I mean, they're complaining that, there are just way too many new infections, and the source of the problem has to be confronted rather than, increasing medical care for them. So the situation of medical care right now in Japan for COVID-19 patients are really spreading thin and facing tough challenge, I would say.
Right, unfortunately that is a reality in Japan at the moment then. Jan, this past weekend over in Berlin, meanwhile, thousands of people took to the streets to denounce vaccinations and restrictions aimed at stemming the fourth wave there. Let's begin with the overall COVID-19 situation in Germany and the reasons behind the protests in Berlin.
Yes, I mean, these protests didn't have a main event because the main manifestation was forbidden. So these demonstrations didn't make a very great effect because you saw the capital walking small groups in the streets. And they are criticizing any measures against containing the virus because most of these people don't see a relevance in the virus. They say it's a virus like the influenza. But as we know, it's not really the case. I mean, we have a similar situation in Germany like you have in Korea. The Delta variant is very contagious. Now we are coming into autumn with falling temperatures, and this seems to suit the virus. So, I mean, experts say that we would need an 80% vaccination rate in Germany in order to contain the virus well. But so far we have only 60%. And, the whole campaign we had in Germany with the vaccination started slowly, slower than in other European countries. And this is the situation we are now in. And also, I mean, it seems that the virus, the Delta variant, seems to spread very good among young people, among teenagers. And this is a group which is until now not fully vaccinated. And of course, we have quite a few adults who don't want to be vaccinated, as we see in these manifestations, which have been long-term planned this weekend in Berlin. All this is summing up to the situation we are now in.
Right. Meanwhile, back here on the local front, Professor Chung, another concern is the growing number of infections among migrant workers, as shared by Chung during Monday's afternoon briefing. Please tell us a bit about this.
Well, we are having a bit less than 2 million foreign residents here in Korea. That comprises about 3.8% of whole population in Korea. And we saw last week 13% of all confirmed cases, more than tripled. That's not the constant figure, but if you look at those tripled infection rate, we can consider the environment first. Their working environment, their living environment are quite vulnerable. So most foreign workers are working in construction places and farms and on ships for fishing. And those places are quite notorious for closed space and poor ventilation and very densely populated region. So that's the main risk factors for those people to be getting infected. Another factor is there is a language barrier, definitely. So when I was working as a director in KCDC, I had to translate into at least 13 different languages to get the foreign workers to be informed, delivered by KCDC. So, but you can see these days on television, you can see English text flowing at the bottom of a television set. But many workers here do not understand Korean and English, so we need to translate their own language, and government should inform them as rapidly and as extensively as the Koreans get. And the other thing we should do, the government should do, is the early vaccination for them. So the most vulnerable people are there, then we should deliver the vaccines, or we should frequently perform the PCR test for them to prevent infection.
Right, vaccinations among our migrant workers as well. Hiroaki, Japan is currently hosting the Paralympics, and I hear that there have been quite a number of infections there, adding on to the burden of the medical arena. What more can you tell us?
Yeah, the number of positive cases among people who are related to the Paralympics is, I would say, very limited. The number I heard as of last Friday was like 230 positive cases, and more than 53,000 athletes, delegates have visited Japan for the Paralympics. But more concern among Japanese people is this program of inviting school students to Paralympic Games. As far as I know, there are like 44,000 students who are scheduled to visit some of the Paralympics Games, and naturally, education boards, parents are worried that these visits, even if they recognize the educational value of those opportunities, can turn into mass infection cases. And as if to deepen this concern, there was this recent cases of 2 junior high school teachers who were found positive after they brought some students to one of those Paralympics games. And 150 students had to be examined as close contact possibilities. We don't know how many would end up having the virus. But this is one of the main concerns in Japan when it comes to Paralympics.
I see. So that is a situation that is unfolding, Hiroaki, then.
Mm-hmm.
Meanwhile, in Germany, Germany itself has maintained one of the world's most open border policy. How is the country, Jan, working to control the spread of COVID-19 among its asylum seekers?
Yes, it is like you have mentioned earlier in the show, you have to focus on the vulnerable groups. And, in the beginning of the pandemics, many of the refugees, people who seek protection in our country, they were living in centralized accommodations, living close to each other. And of course, this is a higher risk to get the infection. So the authorities had to react fast. They tried to accommodate them in a more decentralized way. And when all the vaccinations started, the refugees have been prioritized. Now we don't have any prioritization anymore in Germany, but a half year ago we had 6 categories, 6 different groups, and the refugees had been part of group 3, so they had been vaccinated much faster. I think all this led to the situation that this could be controlled more or less. And I had also the impression that in the streets, by example, the refugees were much more compliant to precaution than Germans do. By example, I saw them much more wearing the masks, by example.
I see. Also speaking of asylum seekers, Professor Jung, hundreds from Afghanistan have been welcomed here in Korea. What is the testing and perhaps treatment procedure for these individuals here in the country?
Well, 390 Afghanis was evacuated by Korean government. I find many Koreans are quite proud of that. And among them, 4 were confirmed as having a COVID-19 virus. And 17 was undetermined at the first time, but among them, 4 were confirmed. And as 4 were confirmed, then their close contacts and their families are in the examination. So we'll see how many more patients are among 390 Afghanis. And the PCR examination process is 3 tiers. First of all, at the airport. And after 1 week in accommodation. And 2 weeks is a quarantine isolation period. And just before the isolation release, they should get the 3rd PCR test. So that will complete the whole PCR examination process.
Right, so it's quite a rigorous process then.
Yeah.
Jan, Germany stands a central hub to evacuate and process Afghan refugees. Do tell us a bit about this humanitarian campaign, that is, including efforts to contain the spread or potential spread of COVID-19.
Yes, the situation in Afghanistan is a disaster, and also this evacuation has been disastrous. In the past 11 days, the Bundeswehr, the German soldiers, were flying out 5,300 people. 500 of them were Germans, but there are still more than 10,000 people in Afghanistan waiting to be rescued. These are helpers of the Bundeswehr, of NGOs, of the media, and nobody knows, what will go on. What is concerning Corona in Germany, I think the situation is under control because all the evacuees who arrive in Germany, they get quarantined for 2 weeks and they get tested. So I don't see any particular danger in this. I think that the situation is much worse in Afghanistan because we don't have good information about the infection rates there in this country. And now, with the Taliban coming in, ruling this country, we know that the Taliban, they are anti-vaccination. So this is not a good perspective for the country.
Right, unfortunately. Hiroaki, meanwhile, what has been the impact of Japan's COVID-19 situation on Prime Minister Suga's approval ratings?
Well, it's pretty bad for the Prime Minister. My newspapers and minus did opinion poll late last week, and his cabinet's approval rating was like 26%, which is worst during his tenure. And only 14% of the respondents supported his COVID-19 countermeasures. So his cabinet's apparent failure to contain the number of new cases and serious cases and the increasing number of people who have to stay home without reach for proper medical care is taking a big toll on his popularity. And his ruling party, the LDP, is having a presidential election later in September 29th. Prime Minister Suga is one of the main contenders. He tries to win his second term, and no one knows for sure what the results will be. But according to our political reporters, many of the younger members of the LDP are complaining about him continuing to taking the lead of the party because they are worried that they may not be able to win the upcoming lower house election, which is taking place sometime later this year. With Prime Minister Suga at the helm of the party, they argue they have no chance to win.
I see. Meanwhile, Prime Minister Suga's counterpart, German Chancellor Angela Merkel, Jan, has shared a shift in COVID-19 strategy from daily infection numbers to cases of hospitalizations. Do tell us a bit about this change in containment efforts, very briefly. We have like 1 minute, I think, Jan.
Yes. Now the politicians are looking more on the so-called hospitalization rate. That means, how many people have to get to hospital because of corona per 100,000 inhabitants. And I think this has 2 reasons. The technical reason is that now we have also vaccinated people who get the infection, but these cases are usually mild, so this makes sense to make it into consideration. The other reason is political. I mean, we are close to elections, and the politicians are afraid of a debate about lockdowns. And hospitalization rates is more flexible. It gives them more room to maneuver. It's not a question of vaccination doses. We have a lot of them. Actually, now the notice was that Germany is giving 70 million doses to African countries.
Right, that was announced, and there's 60% of the population in Germany that has been fully inoculated, as you mentioned earlier, right, Jan?
Now 60% are fully vaccinated.
Right. All right, Jan, as always, thank you very much for that. And Hiroki over in Japan, thank you for joining us today. Professor Zhang here in the studio, thank you very much for your insights.
Thank you.
Right, some are claiming that failure to rein in infection numbers ahead of the Chuseok holiday will result in frightening tallies following this year's Harvest Festival. So do seek to do your part in preventing the spread of COVID-19. Thank you for watching.